I've got some breaking news for you today. This is about 2025 prescription drug plans. Remember how we've been saying that it was a $2,000 maximum out of pocket in 2025? And that's what the Inflation Reduction Act says, $2,000 maximum out of pocket. Well, it turns out, as we are running people's prescriptions and figuring out how much they're going to pay in 2025, that some people are paying way less than $2,000 and still hitting their maximum out of pocket. And it's crazy.
Oh, that's crazy. That's crazy.
So let me tell you what's going on. Remember first that the donut hole in 2025 is going away, and there's a maximum out of pocket from the Inflation Reduction Act of $2,000. Well, it's actually way different than that. And we started running people's medications and finding that some people are only going to pay $329 for the entire year, but still hit their maximum. How is this possible? How could it be that $329 gets you to a maximum out of pocket of $2,000? It doesn't make any sense. So I started digging around and saying, well, let's figure out how this is happening, why this is happening. You know, everything on Medicare.gov is saying when you spend $2,000, you won't have to pay any more for prescriptions. So I couldn't find on Medicare any descriptions. So I started to go to carrier websites and go through carrier materials. Then I found this particular one. Listen to this. This one just shakes me up. I can't believe it. Agents and consumers, this is a direct quote. Agents and consumers do not need to know how to calculate the costs, but they should know that the true out-of-pocket accumulation may differ from what the member pays out of pocket. Really? Agents and consumers do not need to know how to calculate the costs? Really? No, I need to know how to calculate the costs. You need to know how to calculate the costs. We need to know how much you're going to spend on your medications next year. Now, there are a lot of ways. Like we have a lot of tools that will tell us how much you're going to spend on your medications. But when it comes back and it says you're going to spend $500 and you're going to hit your 2,000 max, that doesn't make any sense. I'm like, this is funny math. So we're going to call this today Medicare math. I'm going to call it Medicare, maybe Medicare Common Core math. I don't know a lot about Common Core math. I just know I've seen some funny things online. And you know, my wife and I, we made a decision to put our kids in a charter school because we thought a more traditional math made sense. But here's an example of Medicare Common Core math. So after all of my digging and figuring this out, I can now tell you exactly how someone who only is spending $329 can hit their $2,000 maximum out of pocket. Sounds crazy, right? How could $329 equal $2,000? So I'm going to write it all out here and you follow along and you'll see how this new drug plan format works. And it's surprising that this wasn't explained beforehand. This wasn't explained in the documentation. This is not explained on Medicare.gov. We only figured this out on October 1st when the new plans came out and we did a lot of digging. So here we go. I am going to use the example of someone who has a Medicare Advantage plan with a $0 deductible. They're taking a Tier 3 medication that costs them $47. And the actual retail price of this medication is $1,000. Now you could be listening to that example and saying, wait, is that real? Does that exist? Yes, I'm modeling this after a real plan that I looked up on Medicare's Plan Finder. What we have found is that what counts toward your $2,000 maximum out of pocket is Medicare's standard benefit, which may be what you're paying, but it may not be what you're paying. And if you're not paying the standard benefit still counts towards your $2,000 maximum out of pocket. Medicare's standard benefit says that there's a $590 deductible and that in stage 1 you have a 25% copay. But a lot of plans, they don't have deductibles. A lot of plans don't have a set copay, like a $47 or a $90 or some set copay. And regardless of what you're paying, the standard is applying to your $2,000 maximum out of pocket, the standard benefit. So that $590, if you're not paying it, but the insurance company is, then that counts towards your $2,000. So let's go into this example here. In January, this person is supposed to have a $590 deductible. Are they going to pay that? No, because their plan has a $0 deductible. What are they going to pay? They're going to pay $47 because that's what their copay is. But the actual retail price of the medication was $1,000. So we have a remainder of $410 here, and we're going to multiply that by the standard benefit of 25%, which equals approximately $103. Is the member going to pay that $103? No, they're not going to pay that either because they're just paying their $47 a month. But is that $590 going to count and that $103 going to count towards their maximum out-of-pocket? Yes. So $693 has been added towards the $2,000 maximum out-of-pocket, but the person has only paid $47. Now, February down to July are much easier. It's a $1,000 medication, and we're going to multiply that by the 25% benefit. That's $250. So $250 is what the standard benefit would be for this plan. The member should pay $250, but they're just paying $47 all the way down. So they're not paying that $250. But each month, that $250 is being added and counted towards their maximum out-of-pocket until they reach $2,000. And they're going to reach that $2,000 in July. Now, they didn't spend $2,000. They were spending $47 all the way down. In fact, what they spent, if you add up all the 47s, was $329. So, in Medicare's funky Common Core math, $329 equals $2,000. This person only spent $329 to get to a $2,000 maximum out-of-pocket. So what does this mean for you? Well, it means that every single person, based on the medications that they're taking, based on the drug plan or the Medicare Advantage plan that they have, is going to have a different maximum out-of-pocket. It's not really $2,000. For some people it's $2,000, for some people it's $329, for some people it's $500, $1,200, $1,700. It just depends on the medications that you're taking. How crazy is that? So this, I think, creates some chaos. I'm shocked by this kind of crazy math. Shocked, yes, but maybe not so much because I've been around Medicare a long time and we don't do things simple. If there's an easy way to do it, scrap that. Let's do it some other way. So what we need to do for you is make sure that we look at all of the plans that are available to you, because the difference could be the plan. Let's say you're taking 2 medications. I mean, I based this whole example on just 2 medications, one of them being Ozempic. And we run your medications against the available plans in your area. I don't know what they'll be in your area, but let's assume there's one plan that will cover them like this at $329. Then there's another plan that will cover them at $1,200. Then there's another plan that's going to make you spend the $2,000 plus your monthly premium, if there is one. So if there was ever a year where you needed to have your prescription drug plan reviewed or your Medicare Advantage plan reviewed, it's this year. Because in 2025, the difference between plans, it's stark. Because one plan, again, you could hit a max at $329, where another plan covering the same medications could cost you $2,000. If you have any questions about this, then just leave them in the comments below, or you can reach out to us. And if you want more information about the donut hole going away, watch this other video to catch up on why these changes are happening. Of course, we at PlanFit are always here to help you. We want to make sure that you know that there is no cost to using our services. If you call to speak to one of our agents, number one, there is no cost to you. Number two, there is no incentive to our agents to sell you anything. We look at every single plan available to you, and all of the agents here at PlanFit are paid salaries. They're not paid commissions. So it doesn't matter to them which plan that you sign up for. They just want to help you find the right plan for you. And number three, they will look at everything that's available to you and help you to enroll in the right plan. So if you need anything, call or text us at the number on your screen. We're here to help you. And other than that, thank you for watching, and I'll see you in the next video.